A nebulizer is a device that changes medication from a liquid into a mist for you to breathe in. For our purposes, we are using normal saline. A saline nebulizer treatment can help thin down secretions so they are easier to cough up or be suctioned out. The main components are the compressor, tubing, nebulizer cup, face mask, or mouthpiece, depending on your preference. Prop can supply some normal saline samples to start you off, but once you run out, it is expected you purchase more on your own. You should be able to find them at the local pharmacy or ask your pharmacist. To begin, plug in your compressor, attach the tubing to the compressor, attach the other end to the nebulizer cup, add the full 5 cc's of normal saline, at this point, you want to keep the nebulizer cup upright to allow it to nebulize and also to prevent any spillage. Attach your face mask or mouthpiece. Turn on your compressor. Now, once the mist starts coming out, take some nice, slow, deep breaths. You can breathe through the nose or mouth, but through the mouth might be slightly better as you might get some nasal congestion. It will take approximately 10 minutes for a treatment. Towards the end, you will hear some sputtering. Give it a shake, wait for it to finish. When you're done, take apart all the pieces and wash the face mask, mouthpiece, and nebulizer cup under warm water. Shake off any excess water and air dry. If you don't wash it after the treatment, the residual liquid will crystallize and affect the performance of the nebulizer. Once a week, you can do a deeper clean and wash all the pieces except the tubing with warm, soapy water.